Life, the health show with me, 𝗟𝗓𝗙𝗘. This is a show that focuses on providing you with solutions to your health issues, lifestyles and much more. To recognize the amazing advances with fertility medicines that have helped innumerable countless couples to live their dream, to achieve their dreams in having a baby. Well, today, 25th July, is observed as World IVF Day. IVF or in vitro fertilization has been there around since 1978, and the first successful birth occurred in England. And to know more about the IVF process, we have with us Dr. Mujibur Rahman, who is a gynecologist, an IVF specialist, and is a consultant IVF specialist in Pratiksha Hospital, Guwahati. Well, apart from treating several infertility patients over a span of 10 years, Dr. Rahman has been instrumental in performing the first surrogate pregnancy for the very first time in Northeast India. Well, welcome to the show, doctor. So tell us more about the IVF. What is IVF in general?
IVF, as you have said, is in vitro fertilization, which in layman's term we call it test tube baby. So this is a process where the fertilization of the egg of the woman is done outside the body of the woman with the sperms in the lab in a dish. So the process of fertilization normally takes place in the fallopian tube of a woman. But when something is wrong in the woman's body, her fallopian tube or various other reasons, and she cannot conceive naturally, this process is done outside in the lab in a petri dish. So after that embryo has been formed, we replace it back again inside the mother's womb, and the baby grows there for the remaining 9 months. So until delivery. So this is in short what is IVF. Yes.
So today is 25th July and it is observed as World IVF Day. Tell us the significance of this very day.
Well, as you have said, the first test tube baby was born in 1978 in Bourne Hall Clinic in England. So that was a remarkable achievement of the 20th century, probably one of the milestones in medical science. And the doctors who were involved in delivering the baby were Drs. Edward and Dr. Steptoe. They got Nobel Prize later on posthumously. And the name of the first baby, IVF baby, is Louise Brown. She is herself a mother now, around 40 plus age, and she has become a mother herself now. Since that process, which was done in 1978, innumerable babies have been born all around the world. And we can say that around 10 million babies have been born all around the world after this first step of test tube baby. Now, we observe this day to basically spread awareness about IVF amongst the masses, because most of the people, they do not have a good idea about IVF, because still now they do not know what is IVF. And number two, we also want to dedicate ourselves to the services of the poor patients and the patients who cannot conceive and the patients who desperately need a baby in their life.
Well, doctor, tell us, like, how serious is the problem of infertility in India?
Well, according to World Health Organization, there are around 10 to 15% of women who will not conceive after the end of 1 year, having stayed together and spent 1 year together. So infertility is defined as a condition where a woman doesn't conceive even after 1 year of staying together and having regular intercourse without any family planning methods. Now, according to World Health Organization, the incidence is around 10 to 15%. In India, we do not have a statistics because we have not done a research to find out the exact number of infertile couples, but on the whole, it will be roughly around 15 to 20%. Because it is on the rise, especially in the northeastern part of the country, where we get a lot of cases with infertility who cannot conceive through natural means and have to take the help of assisted reproductive technology.
So does this mean like which patients particularly need to go through the IVF process?
There are some unfortunate couples who will not conceive despite of all these conventional methods. So those are the patients who need IVF. Now, to give an example, the patients who need IVF can be divided into two groups. One is male factor infertility and the other one is female factor infertility. So in the males, it can be because of low sperm count or absence of sperm sometimes. It can be because of low motility of the sperms, or it can be because of very bad morphology of the sperms that are present. In the woman, in the meanwhile, there are several ranges of causes which can cause infertility and require IVF. The prominent amongst them is the tubal factor, where the tubes, both the tubes may get blocked, and the natural process of fertilization, as you know, is occurring inside the fallopian tubes. So if the tubes are blocked, that process cannot take place. So we have to take the help of in vitro fertilization. It can also occur in cases of endometriosis, where there's a disease called endometriosis where there are multiple cysts in the pelvic regions, in the ovaries and surrounding places. So these are the women who ultimately might need IVF. Then there are other causes like polycystic ovary or ovulation disorders where conventional treatment has failed to treat them. And there are several other causes where we do not get exactly the cause of infertility. We have been treating the patients for a very long time, but everything has failed, and these patients will further require IVF to conceive. Especially women who are post 35 years of age, we do not waste much time in them because their fertility is already on the decline, and we try to make them pregnant as early as possible. So IVF is a boon for those people who suffer from all these kinds of causes of infertility.
Okay, now that we have come this far, like tell us what is the procedure involved for the IVF if someone has to
It's a very long procedure, but for the viewers' simplicity, I can just tell you in a nutshell. First of all, the woman is given injections to stimulate the eggs. As I have told you that we need eggs to fertilize them. So the injection process starts from the second day of a period, and it lasts for around 10 days, 10 to 12 days. After the eggs are being formed, we monitor these eggs throughout in a process called follicle study by ultrasonography to see if the follicles are growing properly or not. And after it has reached a particular size, we do a procedure called oocyte retrieval, where with the help of a transvaginal ultrasound guide and a needle, we take out the eggs from the follicle. So these eggs are immediately transshifted to the lab, where the embryologist will check them and see their maturity, and then it will be fertilized with the husband's sperm. Husband will be giving the sperm on the same time, and it will be fertilized with the husband's sperm, and then after 24 hours we'll check whether the fertilization have taken place or not. If fertilization have taken place, we still culture this embryo for another 3 or 4 or 5 days, and then we transplant this embryo inside the mother's womb. This is called embryo transfer procedure. Later on, after 14 days of embryo transfer, we do a pregnancy test to see if the mother has become pregnant. If she has become pregnant, then subsequently the process is the same as natural pregnancy, where she has to undergo regular checkup every month till the delivery of the baby.
So since you have said like there are cases, successful reports of successful IVF process, now are there any side effects if someone has to go through that process?
Well, all medical processes have some amount of side effects. There might be side effects because of the medicines that we use. There may be allergic reactions to the injections that we inject during the stimulation process. Then there can be twin pregnancies or multiple pregnancies. Usually we try to give 2 embryos inside the mother's womb so that to increase the success rate. But sometimes it may so happen that both the embryos may start growing and we may develop twins or multiple pregnancies, which usually has its own complications of preterm delivery and other obstetric complications. Then there is a condition called ovarian hyperstimulation syndrome, where the ovaries react very much, and there might be collection of fluid inside the mother's abdomen or the thorax. So this is a condition which needs treatment. But nowadays we can prevent this condition through various modification of our techniques of stimulation. And during the procedure, if the doctor is not well experienced enough, there might be injury while picking up the eggs. That injury might occur as perforation of the intestines or injury to the blood vessels, or there can be injury to the urinary bladder as well. So, but to sum up, the side effects of IVF are very less, very less compared to the advantages that we get from this process.
Okay, now can you tell us the idea, the concept of surrogacy?
Well, this is a very interesting question, and it's a very burning topic all over the world today. Surrogacy is a procedure where we involve a third person, another woman, to carry the baby of the commissioning couple. So why do we need a third person to carry the baby? For example, if the mother has certain diseases of the uterus, because if the uterus is abnormal, or there are tumors in the uterus, or she doesn't have the capacity to carry the baby till term, but she has her own egg and the husband has his own normal sperms, then we can fertilize the egg with the husband's sperm in the lab through IVF, and instead of transferring this embryo inside the mother's womb, we can transfer this embryo inside the womb of a surrogate mother who will carry the baby for 9 months and then hand over the baby to the commissioning couples. So there are various indications where we go for surrogacy, where, as I have told you, the patient's uterus may not be in a good condition. There might be congenital anomalies, there can be atrophy of the uterus, there can be other diseases like heart disease, or there may be kidney diseases in the mother, which is harmful if she carries on pregnancy for 9 months. So these are the women who will require another help of another third person or a woman other than herself to carry the baby till term. So this is a concept called womb for rent, where we take the mother's womb of a third person and then we fertilize it inside and then transfer it inside the womb of the surrogate mother, who delivers the baby and gives it back to the commissioning couple. But here one thing we should be very clear: this surrogate mother will not be having any genetic material transferred to the baby. It will be completely the genetic material of the commissioning couples. So for example, if I take the sperm of the husband and the egg of the wife, the baby will be theirs. No genetic material from the surrogate mother is going to come in the baby. And one thing has to be stressed upon is that there has to be a very proper counseling of the surrogate mother, because there may be instances where the surrogate mother may not like to share the baby after delivery, even though she had signed a contract and other things and said that I am going to give the baby to the parents after I deliver. But that maternal instinct or that maternal bond may be so strong after the delivery of the baby that she might refuse to hand over the baby. But this has very rarely happened, and so that's why a very thorough counseling of both the commissioning couples as well as the surrogate mother is very essential before embarking on the process.
Talking about surrogacy, it involves the couple and a third person. So now talking about that how are the new Indian laws regulating the IVF and the surrogacy process?
Yes, previously IVF in India and surrogacy in India was unregulated. There were many centers which didn't have any registration. There were many doctors who did not have the qualified experiences to provide IVF services and surrogacy services. So in 2021, the Government of India, Ministry of Health and Family Welfare, passed a bill which became an act in both houses of the parliament, where they brought in some strict laws to control this entire thing. So like, for example, I'll give you a few examples. It's a very long act, but one thing is that as regards surrogacy is concerned, we cannot take a surrogate in lieu of money. We cannot lure the surrogate with money. It has to be absolutely altruistic. The surrogate has to be doing the service as a kind of human service to the couples. and there has to be proper counseling of the surrogate mother. The surrogate mother has to be insured with a health insurance policy. It was not there before. So if anything happens to the surrogate mother during the process of pregnancy or during childbirth, she gets a substantial amount of money from the health insurance. And then proper investigations has to be done to the surrogate mother to see if she has any diseases or not. And similarly, when we go for a surrogate pregnancy, it has to be taken into consideration that the husband's sperm and the wife's egg is used. We cannot use a donor egg or a donor sperm. So these are some of the changes. As regards IVF is concerned, nothing much has changed, except that when we go for donor egg or donor sperm, they have formulated certain rules where the donor egg and the donor sperm has to be brought through an agency which is called egg bank or sperm bank. So we cannot directly recruit people to give semen or supply eggs. It has to go through a proper channel.
Okay, talking about the infertility that declines down by the late 30s, like does any contraceptive pills or anything to do with that has also affected the numbers of infertility in the recent times? No,
contraceptive pills as such doesn't reduce fertility of a woman, but of late there are several other reasons like drug abuse, the food that we take, adulterated food, the environment that we live in, smoking, alcohol, all these things have contributed to premature ovarian failure. Earlier, women used to remain fertile up to 45-50 years, but nowadays we find no eggs in a woman of 30-32 years of age. So this is a very big problem, and the entire scientific world is looking after the causes and how to prevent it. So the best way is to socially freeze the eggs. So there is a new concept called freezing of the eggs. For example, nowadays the women are very much career oriented. So they want to settle down in life, they want to complete their studies, and then they get married. And after getting married also, they want to postpone their pregnancy for a few years. And by the time they are almost 37, 38 or 39 years of age. So now the concept of egg freezing has come up, where a woman can freeze her eggs at an early age, like 28, 29 or 30 years of age, when she's doing her studies or other things. We can stimulate her, take her eggs, and we can cryopreserve it for around 10 years, 10 to 15 years. So that subsequently when she requires the eggs, when she gets married and prepares to get a child, we can use her egg instead of taking a donor egg.
Okay.
So she can become the biological mother.
Okay.
Of a baby.
So can you tell us more about this new process of freezing the eggs? Like how
freezing
can someone
we have already started. We get a lot of enquiries, especially from film stars, professionals, models, or businesswomen who do not like to get married so soon. So we always advise them to freeze their eggs.
Okay.
So if they freeze their eggs, the tension is gone. Whenever they get married, maybe in the late 30s, 40s or whenever, they can always become a mother.
Okay, is this very prevalent in Guwahati or in Assam?
It has started in India since last 8 to 9 years, and we are getting a lot of queries in Guwahati, and we have started doing it.
Okay. So does this include these other recent advances in IVF process, if I may say?
Yeah, this is also one of the recent advances.
Can you tell us more recent advances on the IVF process?
Well, IVF is a very exciting, not only IVF, the entire reproductive medicine is a very exciting thing, and every day something new is coming up. So we have to catch up with it. Nowadays a lot of things can be done. IVF, since it started in 1978, had very few limited success rates, but with the development of technology and media and other things and the drugs, now the success rate is phenomenal, and it is within the reach of a common man. Earlier it used to be very costly. So now what we do is, in the lab, new technologies have come in to help the doctors in IVF procedures. One is artificial intelligence. through artificial intelligence, we can select the best quality embryos. Earlier, it used to be done by the embryologist by looking under the microscope. But now, through AI, we can do it with the help of embryoscope. We can take the help of an embryoscope where we insert a camera inside the incubator to monitor the growth of the embryos. And the artificial intelligence data will select the best quality embryo. So this is one very big achievement. The second big thing is genetic editing, which is very controversial. In this process, we can genetically edit the DNA of a baby before implantation. It was initially started with a very good intention of preventing familial disease. There are many hereditary diseases which can pass on from parents to the babies. So if we do this process in such patients, we can detect the particular DNA responsible for this disease, and we can either omit the particular DNA segment, or we can alter the DNA altogether so that the embryo is healthy and the baby remains healthy. So this started the concept of gene editing, but nowadays some unscrupulous people all over the world have started doing a practice called genetic editing for designer babies, where they edit the genes of the embryos and alter the height of a baby. They can alter the height of a baby. Suppose they want a tall baby, so they will select the particular gene and they will alter that gene so that the baby that is born out of that embryo will have a very tall structure. Similarly, some may prefer a fair looking baby, so they will edit the gene or alter the gene in such a way that the baby that is born has a very fair color. Or similarly, a lot of other things, the concept of designer babies, just as we have designer clothes. So the concept of designer baby, but it has raised a lot of moral and ethical questions, and of late it is banned by almost all the countries of the world except some surreptitious clinical labs in China and Southeast Asian countries.
Okay, we have talked about the process, what IVF process is all about. Now tell our viewers about the cost and time involved in the whole process.
Well, this is a very important question. The overall time involved in a cycle of IVF is around 3 to 4 weeks, and it is during this process the patient has to be present in the nearby the center. She need not be admitted in the hospital. She has to come and go, taking injections, doing follicular monitoring, and etc. Only during ovum pickup and embryo transfer she is admitted in the hospital for a few hours only, and it's usually over by 3 to 4 weeks. Sometimes if you go for frozen embryo transfer, then we call the patient in the subsequent cycle. As regards the pricing is concerned, initially when IVF was first started in India, it used to cost a very huge amount of money. And so the cost varies from clinic to clinic, center to center, and from place to place. And it also depends on the doctor of who is treating the babies, who is treating the couples, I mean. So on an average, it ranges from 1 lakh rupees to 2 lakh rupees. So why this difference? It's because a lot depends on how many eggs have been forming, what are the kind of stimulation that we give, whether we give recombinant injections or we give the normal ones. It depends on whether we culture it till blastocyst. It depends on how many embryos are formed and how much media is utilized. It depends on whether we do a plain IVF or we do ICSI or ICSI. So there are a lot of factors which consider as far as the cost is concerned, on which the cost depends. So, but on an average, 1 lakh, between 1 lakh to 1,50,000 normally everything happens. In some cases it may go up to 2 lakhs as well. This is normally for own eggs and own sperms, but if someone goes for donor sperm or donor egg, then the cost might rise a little bit.
Okay, can you tell our viewers like for how many attempts can a couple go for an IVF process?
Well, as such there is no limitation of how many cycles you can go, but usually most of the patients conceive within 3 cycles. For example, if I get 10 embryos in the first cycle, I will transfer only 2 embryos, and the remaining ones I'll cryopreserve for further use. So her cost will be reduced in the subsequent cycles, and even the time will be reduced in the subsequent cycles.
So has there been cases where a mother has conceived a baby through a IVF process, can also go for a second time?
Yes. Okay. There are instances where people have conceived through IVF once and they want a second baby. So if those lucky women have cryopreserved embryos with us, frozen, then we can use those cryopreserved embryos and transfer it inside her womb, and she can have a second baby. We have so many patients who have their second babies after 3 years, 4 years through their own embryos that were cryopreserved during the first cycle.
So lastly, doctor, what would you like to send a message to the viewers who are watching this show right now?
Well, IVF, I should say, is a boon for couples who otherwise would not become parents. There are so many indications where pregnancy was impossible before the advent of IVF, but now the parents can become, become the parents of a child. They have their own biological child. They can gain the parenthood, the feeling of that parenthood in them. So, but one thing has to be taken into consideration is that whenever you choose an IVF clinic, always choose a reputed IVF clinic and a doctor who is well experienced, well versed, because nowadays there is mushrooming of IVF clinics all over the country, and some have taken this up as a commercial venture, as a business venture. So I would request all the infertile couples who are watching this today to be very careful as far as choosing their IVF center is concerned and their doctor.
Well, thank you, doctor, for joining us on Good Life, the health show, and enlightening our viewers about the whole process of IVF and how it has been prevalent in India and in Northeast India. Thank you for joining us.
Thank you very much.